Well, welcome back. I'm Sheldon McLeod, and this is Thinking Out Loud, presented to you here on the SaltWire Network. And, it was probably the early 90s when I got in the media business, and there was a promise that I heard, and it went back to it was actually an all-party committee in 1989 in the House of Commons. And they said, we're going to eliminate child hunger in Canada by the year 2000. Campaign 2000 was what it was called. I bring that up because in the context of this conversation, we talk about child poverty and where Nova Scotia fits on that. And the Canadian Centre for Policy Alternatives Nova Scotia chapter has released its latest report. And as my colleague Nicole Monroe reported at SaltWire, Nova Scotia's child poverty rate dropped by record numbers thanks to COVID-19 financial assistance, and wanted to talk a little bit more about that. And we do so with one of the report's co-authors. Dr. Lesley Frank is with the Sociology Department, a professor there at Acadia University. And thank you very much for joining me. I really appreciate this.
Thanks for having me, Sheldon.
When this is an annual report, this is the 2022 edition of that report, and that sounds like good news. Is this good news?
Well, it is something to be celebrated. I've been writing the child poverty report card with the CCPA-NS for over a couple of decades now, and there's often not a lot to celebrate. We've seen some reductions in child poverty at different time points over the last 31 years, but we've never actually achieved anything lower than 24% of child poverty in Nova Scotia during that time. So the celebration, I guess, this year is that the data shows from 2020 that with some bold, sort of swift government interventions, we can lower child poverty. So we had a rate of 18.4% in the year 2020.
And you attribute much of that decline to the fact that there were federal programs available, and these were cash programs. These weren't credits. These weren't incentives. This isn't getting a thing you can write off on your taxes at the end of the year. This is hard money in your pocket, and it helped fill bellies.
That's correct. I mean, and it was a fairly swift action too, and easy to apply for. And so, we saw the biggest decrease in a single year ever since we've been tracking the child poverty rates. So it reduced by 24.3%. So in that single year, Sometimes it doesn't increase at all. I mean, or sometimes it doesn't decrease at all or marginally increases.
So that was something that you had not seen, and I'm curious to the reaction so far. What are people saying about the research that you've done in the report that you've produced from it?
Well, those in the know and those that are working with families that are experiencing poverty and food insecurity and have been doing the hard work on the ground, of course, they're not surprised, and I'm not surprised because we knew that the actual amount of the investment that came from the federal government would likely lower poverty rates. It was at an amount that was more than typical that people living, for example, on pure government transfers, so those that had no market income, that the rate, for example, from the CERB was significantly more than many low-income families were receiving previous to that. I mean, while there's a reduction, of course, there's also 1 in 6 children that it didn't help, right, that are still living in low income circumstances in the province. So the pandemic benefits were effective in reducing the child poverty rate just in that single year in themselves by 31%. So, I mean, they're not the only government transfer. I mean, when you package them all together, that included with the Canada Child Benefit and GST payments and that people had been getting prior to that, the overall reduction is in child poverty is fairly significant in a single year, right? So it can reduce it. Like if without all those things, the child poverty rate, would have been much higher, like at 41%, for example. So it's at 18.4.
And to take a look at, that is a snapshot of the past, and we look at food inflation at unprecedented levels. We look at this conversation about grocery stores and the profit survey, talk about lineups at the food banks and the demand on those infrastructures. So is it inevitable that number is going to go back the other way?
Well, that's what we all expect, yes. So, I mean, we may not see that until we have 2022 data, because some of the, of course, pandemic benefits carried on into the year 2021. But what we do know that from anecdotal, conversations with our neighbors and from the stories being told from family resource centers and from food banks, just the sheer desperation people are experiencing, and they're claiming that they're seeing record numbers in food banks. Family resource center staff are just on the ground, strapped, still doing the work of helping people access resources, but doing a whole lot of new food security interventions as well, in a way that they hadn't done previous. So it's not just food banks. Other organizations are rolling out also in a number of different food-based interventions, which help people maybe access food today in ways that they wouldn't without those interventions. But it doesn't get at the root causes of why people are experiencing higher rates of poverty and higher rates of food insecurity likely today. I mean, our data to track that is always a bit slow at coming. So the evidence comes after the stories, then, the quantitative evidence. But.
And to not make it a political story, but it is political. This was because of a government's reaction to a global pandemic. And often I hear people in the social services community say, you'll either pay now or you'll pay a lot later when it comes, when it manifests itself in other ways. So where are the lessons? What can we tell the politicians about what this shows us about humanity and the sociology of food, as you described?
Yeah, well, I mean, there is a real lesson in this report card that, it was good to write about it. Personally, like I said, often there's not much of a new story to write in the child poverty report card. But the lesson that we learned from what can happen when there is bold action, when it's swift, for kids, that means a lot. Kids can't wait for small, we'll tinker with this amount of assistance, we'll raise a rate by $100 per family. I mean, that doesn't do anything to move the needle on a poverty rate. Because those incomes in those families are so far below the poverty line that it's only bold action, like setting a rate that we know is above the poverty line, that actually changes the poverty rate. And so, we can put some tactics in place, and we often read about, a small increase to income assistance, for example. That might buy one bag of groceries. It doesn't do anything to shift the needle, like I said, on poverty rates.
This is clear evidence, empirical evidence that you can provide to say, as a government, as an MLA or an MP, that this is something that can make a difference in people's lives in a real measurable way. So as you say, tactics and techniques. This report also offered up a number of recommendations. What can you tell me about some of those in that context?
Well, our first recommendation would be that we need a plan, right? We need to pay attention to the evidence, and we need to be realistic about what our interventions are. That's making a poverty reduction plan that has targets, timelines, and interventions we know will bring families above the poverty line. If we want to see a change, we know what those poverty thresholds are. And we need to ensure that incomes, whether they're coming through wages, whether they're coming through government transfers, bring us there. Because children, I mean, their lives are short. The impacts are long lasting. And they can't wait. They can't wait for us to like, try this, try that, see what happens 2 years later. We need an actionable plan. And it's not just, I'll just add, it's important to recognize that some groups of children are much poorer than others. And so it's not just about income. There is systemic discrimination and inequality dynamics that's underlining why some groups of children have higher rates than others. And we've seen this year after year after year. And with this report card, we were able to report on the census data from 2020, which allows us to disaggregate child poverty rates by groups of children. So we know that racialized children almost have double the rate of child poverty than non-racialized children. New immigrant children in Nova Scotia have a child poverty rate that's 32%, or yes, 32.6%. Right. I mean, Indigenous children living on reserve in Nova Scotia have a rate of 43.6%. And so, sometimes, unfortunately, governments will do a little bit of, well, look at this poverty statistic with this bit of, data to support it, which shows a rosier picture. But often those data sources actually exclude, for example, all First Nations children living on reserve. And so, we need to be transparent about the data and look at all the data that's before us when we're creating these plans as well.
Well, as you point out, it's a bit of a good feeling to know that there was a difference that was made. Unfortunately, reality comes to, hunger pains right back to the beginning. So, Lesley Frank, is there anything else that we should add or you'd like to say before we wrap this up?
Yeah, so I mean, it's just a final thing. I'd say, there's something to celebrate. There's evidence to know we can do it. And these interventions that were bold and that did work can't be temporary. We will pay later.
Dr. Lesley Frank, Professor, Tier 2 Health Canada Research Chair in Food, Health and Social Justice at Acadia University in the Sociology Department. Thank you so much for this.
Thanks for having me, Sheldon.